السلام عليكم ورحمة الله وبركاته. Our section today about abortion. What is meant by abortion? Abortion is expulsion of the uterine content of the gravid uterus before full term. What is the medico-legal importance of abortion? Number 1, a woman alleging abortion after a blow in a quarrel. Number 2, a woman notifying that a medical man gave her some abortifacient drug. Number 3, a woman wishing to conceal abortion after being charged with it. How to diagnose a case of abortion? Number 1, the patient consents and complete story. Number 2, signs of pregnancy, especially early signs. Number 3, signs of general violence. Bruises may be present on her abdominal wall in cases of blood during a quarrel. Signs of local violence including uterus, cervix, vagina, foreign bodies, embryonic tissue. Laboratory investigation including disease or a drug. Products of abortion: we do pre-septin test to identify the type of tissue, human or not. Estimation of fetal age depends on: Number 1, changes occur in the fetal length. At the first month, fetal length is about 1 cm in the size of pigeon's egg. At 2 months, fetal length about 4 cm in the size of hen's egg. At 3 months, fetal length is about 9 cm. At 4 months, fetal length is about 16 cm. 5 months, it's about 25 cm. 6 months, it's about 30 cm. At 7 months, it's about 35 cm. 8 months, it's about 40 cm. Full-term fetus length is about 45 to 50 cm and the weight is 3 to 3.5 kg. So, in the first month, length of the baby equal square of the month or the month multiplied by itself. At the 7th month, the month multiplied by 5 to gain the fetal length. Second parameter in identifying the fetal age is development of the placenta and the cord. At first, placenta is named chorion. What's chorion? Chorion is the outermost fetal membrane. It undergoes rapid proliferation, giving multiple processes named chorionic villi. Chorionic villi then invade the uterine decidua, giving nutrition for baby. At first, it is not vascular. Then it undergoes complete vascularization till complete development of the placenta at about 3 months. At 1 month, placenta, the chorionic villi surrounds the whole baby. At 2 months, chorionic villi aggregated to one side. At 3 months, placenta is well formed. As we see, at first, surrounding the whole baby, then aggregated to one side, then complete formation of the placenta. About 4 months, placenta weight is about 100 gram. At 5 months, about 200 gram. At 6 months, about 300 gram. At 7 months, about 400 gram. 8 months, about 500 gram. full-term fetus placenta weight is about 600 grams, measuring 30 centimeters in diameter. Umbilical cord length in full-term fetus from 45 to 50 centimeters. Second parameter in identifying the fetal age is sex differentiation. Complete sex differentiation occur about the 4th month. So, any jar doesn't show sex differentiation. This means that age is less than 4 months. Third parameter is the appearance of the ossific center. Bone at the beginning is formed of cartilage, then converted to bone and appear as ossific center. Ossific center appear in jar as brown spot. At 2 months, ossific center appear in the clavicle, lower jaw, and bodies of vertebrae. At 3 months, ossific center appear in the shaft of most of long bone. At 5 months, ossific center appear in the calcaneum, pubis, and ischium. At 4 months, we notice that there is no ossific center appear. This is calcaneus, and the bone above it named as talus. This is jar containing fetus. Later on, we will identify the age of it. This is also jar containing fetus. Later on, in the end of the section, we will able to identify the age of the fetus. At 6 months, the ossific center appear at the manubrium sterni. 7 months, ossific center appear in the talus. This is talus. This is talus, the bone above calcaneum. Appearance of ossific center appear as brown spot, as we see in the calcaneum and the talus. Also here, it appear as brown spot. At 8 months, ossific center appear in the lower end of femur. Full-term fetus, the ossific center appear in the lower end of the femur and reaches about half centimeter in diameter. Ossific center appear in the cuboid, the upper end of the tibia, the head of the humerus. At 4 months, hair and nail begin to appear. At 5 months, the body is covered with lanugo hair. What is meant by lanugo hair? It's a fine hair covering the whole body of the fetus, like this. Also, development of hair and nail, including that at 8 months, fingernail reach about the tip of the fingers. Full-term fetus, nails are growing beyond the tips of the finger and reach the end of the toes, like this. Like this. It changes that occur in the eyes and the skin and the testes. The eye, at about 6 months, eyelashes and the eyebrow begin to appear, and the pupillary membrane disappeared. What is meant by pupillary membrane is a membrane covering the pupil and giving blood supply to the lens. At 7 months, the eye is opened. The skin at 6 months is red and wrinkled. At 7 months, the skin is still wrinkled with a small amount of subcutaneous fat. So, any jar containing a fetus with wrinkled skin, this means that fetus is less than 8 months. Wrinkling, as appear in our jar. 8 months, slide pass, skin loses its wrinkling. Now in this slide, a jar containing longitudinal section of the thigh and leg and a foot. What is this yellow coloration? This yellow coloration is subcutaneous fat. And what is this? This is ossific center. This also subcutaneous fat, and this is ossific center. This is subcutaneous fat. Also a jar containing longitudinal section of a leg and the foot, showing subcutaneous fat, but in this jar subcutaneous fat has a white discoloration. It differs from a jar to another. Also, this is subcutaneous fat. Testes about 6 months are at the level of the kidneys. At 7 months, it reaches the internal inguinal ring. At 8 months, it reaches the external inguinal ring. Full-term fetus, its testes descended in the scrotum, as we see in this slide. Limbs at first appear as flat buds, like this, also like this. About second month, limbs are distinguished. Third month, limbs appear with finger and toes are well developed. Second month, the mouth and the nose are separated opening. In full-term baby, the head circumference about 13 inches and the scalp hair is about 3 cm in length. Like this. The posterior fontanelle in full-term baby is closed, while anterior fontanelle is not. It closes about 18 to 24 months. Now we finish all the parameters that we depend on it to identify the fetal age, including length, placenta and cord, sex, presence of the ossific center, hair and nail, skin, eyes, testes, and others. Now we will see some jars and try to identify the age of the fetus. This jar, this specimen, is aborting fetus full term. Why we say full term fetus? Because length of the fetus is about 45 to 50 centimeter. Placenta is present and about 30 centimeter in diameter. Umbilical cord length about 45 to 50 centimeter. Nails growing beyond the tips of the finger and reach the ends of the toes. Head circumference is about 33 centimeter. Scalp's hair length about 3 centimeter in length. Ossific center at the lower end of the femur reach about half centimeter in diameter. Also ossific center present at the cuboid, the head of the humerus and the lower end of the tibia. This jar containing a fetus aged more than 4 months and less than 5 months. Fetal length, why more than 4 months? Because sex is identified and fetal length about 16 centimeter. Why less than 5 months? Less than 5 months because الأوسيفيك center not appear at the calcaneum. Also, this jar containing fetus aged more than 7 months and less than 8 months. Why more than 7 months? Because the fetal length about 35 centimeter. Skin is still wrinkled as we see. Skin is still wrinkled. Ossific center present in the calcaneum and the talus. Why we say that less than 8 months? Because the ossific center not appear at the lower end of the femur. This jar containing longitudinal section of full-term fetus containing this is a jar containing longitudinal section of the thigh, leg and foot of a full-term fetus. Why? Because the ossific center of the calcaneum relative big size due to its appearance since the 5th month. Also, appreciable amount of subcutaneous fat, as we see, deposition under the skin. The second jar also containing longitudinal section of the thigh, leg and the foot of full-term baby. The ossific center appear at the calcaneum. Also, the ossific center of the talus present and appear at the 7th month of gestation. Ossific center of the lower end of the femur appear at about 8 months of gestation. Also, subcutaneous fat, appreciable amount of it, deposition under the skin. Now we finish our section. I hope you understood the section well. Thank you.